came first on Friday, saying from the management and from staff and heads of department, saying they're in trouble. They require water or portable toilets or some kind of water supply because the hospital has an undersupply of water and there's something wrong with the functioning of the water supply to the hospital. So we sent that on Friday afternoon and we thought that's the end of the story. On Monday they called again. They said, could we help them further? And then that's when I inquired. I said, what's wrong with your hospital? And they said, look, we haven't had water from the 19th of May. And, the reservoirs are affected, the pumps are affected. They're saying it's ESCOM, they're saying it's load shedding, they say it's infrastructure. We don't really know. We don't have the answers. But in the meantime, it's impacting on the patients, the hospital, and also that people in the community nearby don't have water either. And they come to the hospital, and the CEO has been very generous, offering them water, even though the hospital itself is dependent on water tankers bringing water into the hospital. But you can't see people being thirsty and turning them away. So I said, then you guys need a more sustainable solution. Bottled water is very short term, and you guys we need to drill boreholes on your ground. They said we would love that. And then I asked, do you have any other boreholes on the ground that may be disused or non-functional? They said they think so. Anyway, on Tuesday, the team went yesterday. They were there yesterday evening. We found one borehole. It's disused, but we can't get to it because the buildings are in the way. You can't drive through the buildings now. So that process is gone. We had to shove that idea. We started drilling this morning. We've reached 46 meters. We found the first bit of water, but the ground is very soft. So we have to put in steel casings before we drill further. And whilst drilling there, we got a call from Helen Joseph to say they have a similar problem. Can we drill there? So our teams have gone on site to Helen Joseph also. So the aim here is to provide water for non-drinking purpose initially into the hospital system, push it up with a booster pump, provide water for drinking purposes once the tests come back, which take about 14 days for the hospital. And then if the hospital agrees, to put taps on the outside for the community to drink that water once the tests have come back. It's approved to drink.
Now, Dr. Sooliman, the work that you're doing as Gift of the Givers is really exemplary. It's stellar. And I'm wondering, where do you get the financing to be able to do all of the work that you do, and how much does it actually cost to even drill a borehole?
So, well, the financing is from the public. 100% of the money comes from the public. It's from all stratas, all spheres of people. It's school children, it's pensioners, it's business people, it's professionals, it's corporates, it's people, ladies run their own business, home industry, everybody. It's across the board, from organizations, from groups, everybody gets together and money just comes from everywhere. We're very fortunate that we don't have to look for money. Our projects speak for themselves. What we have, we try to implement to benefit people. Our borehole could cost anything from 80,000 to 550,000, 600,000. And it's dependent on many, many, many factors. First of all, from how far does the borehole rig has to come to the site? What type of rock is in the ground? How many bits are you going to use? How deep you're going to drill? Yield testing, water testing, connection to electrical supply, the amount of JoJo tanks you're going to put. Are you going to use solar panels? Are you going to put in pipelines to drill the water, to move the water distances? All this doesn't need a filtration system. All these are things that have to be considered. So it could be anything from 80,000 to 550,000 or more. For this borehole at the moment, we're budgeting 550,000.
Well, that's quite a hefty sum of money. You say that also Helen Joseph Hospital has reached out to you. What services will you be providing for them?
Exactly the same that we're doing for Rahima and Moosa. They seem to have the same problem, and they seem to be, in this only a kilometer away from this hospital. So we will do the same thing what we're doing for Rahima and Moosa, unless there's something different they want there. I doubt it. So they're just telling us, do what you're doing at Rahima and Moosa for us, which is quite simple. Find the borehole, pump it to the hospital system for non-drinking purposes, get the test, make it available for drinking. And I don't know if they have communities outside them that also have a problem with no water. So we look at all those, when my teams are they're on their way now to meet the CEO.
And you mentioned something quite interesting there that piqued my interest. You mentioned that the water still has to be tested, even though it does actually come from the ground once you reach a level where there is water. What is the likelihood of the water not being usable, the underground water that you get from the boreholes?
It's very likely. It's happened to us many times before. It depends, when we know what rock is under the ground, in most cases we are right in our prediction to say the water can be used. But sometimes, we have to force to drill in rocks which are not so grand, the rocks that provide water. because they have high chemical content of certain items. For example, if the fluoride is too high, if the iron is too high, if the sulfur is too high, if there's E. coli, if there's parasites, if there's other chemical ingredients which are harmful to the body, it can be sorted out. But then you have to put in expensive filtration systems. For example, our borehole in Makanda, that we spoke about last week, in Sika school, we call that the super borehole. It can produce 1 million liters of water a day. But whilst doing that, there's a very expensive filtration system on site that costs us 1 million rand to design and develop and put it at that borehole, because it has to purify that water from chemicals that are not, is not safe for people drinking. And that has to be maintained every month. And the cost ranges from between 15 and 20,000 rand a month just to do the maintenance on that filtration system. So, there are certain elements that you can't bring. They have to be cleaned out. And if it's too bad and it's really, really very salty, that's another problem. Water can be very, very salty and it's got terrible taste. You can't drink it. You have to look for another area to drill a bowl somewhere else.
Oh.
And that's when the costs start coming up.
Just based on what you're saying, Dr. Sooliman, it sounds like it's still early days to start rejoicing. This is just the beginning of the process. But thank you once again for your time today and for the amazing work that you continue to do in the communities around South Africa.